Just a few more finding their way in. Well, this morning we were able to get a global picture of what's going on in relation to pharmaceuticals. This afternoon in these split sessions gives us a chance to focus down in more specific areas and to look much more locally at some of the issues. I think everybody in this room is aware of some of the catastrophic abuses that have happened in relation to introduction of and testing or trialling of pharmaceuticals in low-income settings. We're not going to dwell on these this afternoon, but we're going to look at a range of issues that have sprung up in relation to these problems. And specifically, we're going to look at what we call the ethics of evidence, and look at how evidence for treatments, for research more generally, can be gathered, and what are the ethics of doing that or of not doing that. So I'm really pleased today to have a nice range of people speaking from a range of perspectives. We're going to start with Dr. Adamu Addissie, who's an assistant professor at the School of Public Health at Addis Ababa University. He's going to introduce us to some of the problems on the ground faced by researchers as they struggle to try and harmonise international expectations in relation to ethics and what's happening on the ground within Ethiopia. From Adamu, we're going to move on to Dr. Trudy Lang, who's here from Oxford University and the Global Health Trials Network, who's going to sort of set the scene in terms of why we really need to do trials, to test out pharmaceuticals, despite some of the ethical issues that Adamu has raised earlier. Then for the third presentation by Professor Bobby Pharmaceuticals, we're actually moving over to a film that she has made about one approach to this whole area. And finally, Professor Newport from this medical school here, Brighton and Sussex Medical School, will give us a couple of examples from Ethiopia and from Cameroon of using a technique on the ground to try to address some of the ethical issues. And I'm delighted to have as discussant on the panel Dermot Maher from the Wellcome Trust, and he's going to summarise step by step and also sort of coordinate questions at the end. I'm not going to introduce each participant individually as they come up. I'm going to try and let this session flow reasonably seamlessly. So over to you, Adamu, for your first presentation.
Okay, thank you, Dr. Gale. Good afternoon. I'm coming from the School of Public Health in Addis Ababa University, and at the moment I'm also working on a PhD project at the Brighton and Sussex Medical School, looking into the ethics of research in developing countries. And I will be just giving you a glimpse of what some of the findings from this project, and we'll be looking into what we found were the views of researchers related to some of the gaps in the ethics of research in the Ethiopian setting. And looking back to to give you just a little bit of background, we have universal ethical standards and principles governing how bioethics should go about, including the conduct of research. But the origin of this universal guidelines is mainly Western, and the values and the approach are also designed by the Western concepts. But we are adopting these universal guidelines for international use, including the developing world. And when we come to actual applications, realities are very diverse, and also some of the assumptions in the universal principles might not exactly hold true when we go to the ground. So we have to be flexible enough to accommodate the variabilities in the ground and try to understand those context-specific issues. And researchers have come up with various recommendations of this approach, like having a participatory way of trying to make sure that the universal principles are tailored to the needs of the participant in the ground. If we have looked into some of the literature in this area, we would see that for a consent process, which is an important step in recruitment of participants in any medical research, there are two important components into it, which is the information part and the decision-making part. And these two are, again, influenced by various arrays of factors, as you could see. You might not see all the boxes, but we have the guidelines, which are important, but the guidelines are functioning through cultural contexts, for example. And also the levels of understandings of the participants, the educational status, expectations and things like that would be also the communication mechanism and the channels would also be important. So this is a very simple illustration of the framework how consent process is dictated by a number of other issues beyond just guidelines. So in this project, we try to look into what would be the perceived gaps on the conduct of research in the Ethiopian setup, and we went on and tried to talk to some researchers over there. Ethiopia is a country of 87 million at the moment, but it's a very diverse country. It's in the eastern of Africa, around the Horn of Africa, but so diverse in terms of language and ethnic diversity, with over 80 ethnic groups and 80 different languages spoken. And in addition to that, at the moment there is also increase in the number of studies being done, medical studies and researchers, owing to the fact that there is some recent development in expansion of higher education, including medical education. And just to give you just a picture, in the last decade, in the last 2 decades, the number of universities have grown from just 2 to 31 in just two decades, and half of them were in the last few years. And in my university, at Addis Ababa University, the number of graduates just this year, a month ago, was 8,800, and the same year we had about 6,000 interns. And this is just to give you a picture of how it's going. So we thought that Ethiopia would be a right place also to try this to explore this approach of how diversity and context might be influencing the conduct of research. So we did a kind of a mixed study and looked into about 4 institutions within Ethiopia, and we did both a self-administered interview using an online survey technique. We used SurveyMonkey, and this is probably one of the first studies in Ethiopia to use SurveyMonkey. And we also did an in-depth interview, about 90, with researchers, ethics committee members, and policymakers. These are the 4 research sites. 2 are in Addis, and the other 2 are relatively older medical schools in the country. So just to give you some findings, this is the range of expertise among the researchers. We had public health researchers, biomedical researchers as well, and also from the social science and from the medical science. And also the participants had different levels of exposure to research as investigators, co-investigators. Some even had some experience in the field, including data collection. And we also had some members who had experience in the review of research proposals. And one of the findings was about 34% of those who were involved actively in research didn't have any training on research ethics. And we asked them from their experience, how is a consent form prepared? And majority said it's prepared by the investigator, which means by the investigator means just the investigator by himself without any consultation with the context, or talking to the potential participants and things like that. Another finding was we asked them what they feel about the best interests of, whether the best interests of the participants are considered, and only few said that they think the best interests of the participants are considered in the consent process. And some of the problems they identified were lack of clarity of the consent form, failure to provide adequate information, problem of language, and the like. As you could see, were some of the gaps. And we also asked kind of the same questions during the in-depth interview, and kind of similar themes appeared in the qualitative as well. And they talked about language, lack of awareness, expectations, and again, lack of adequate information. And I will just give you some of the quotes from what they said about this. Coming to language, as I have said in the background, there is a diversity in what language is being used depending on the setup where the research is to be conducted. And at times, some of the language might not have enough words to explain technical and scientific terminologies. This is already a gap. And so how can a researcher would go and inform the participants in clear terms so that they would understand? And also in some setups, depending on the levels of literacy and awareness about science, if there isn't enough literacy and no much awareness about science, it's also difficult to have a concept about the whole idea of research. What's research? And confusing research with treatment and the like. So this is also another gap which was mentioned. And Another is also related to understanding what benefits the participants might have from the research. So there will be confusing the research with a treatment and expecting treatment from the researcher, the research, and also difficulty in conceptualizing the fact that this research might benefit someone else who's not part of the research. That's also might not be easy concept to explain to the participants. And this is a gap, from the researchers' side. So researchers will go for a consent and make sure that the participants are giving consent. But informed consent is not just a consent; it's an informed consent. So the information part is not given equal weight in some instances. So there is a focus more on the consent and looking it as if this is a formality than the moral value behind it. And again, which is a related one. When it comes to ethics of research, researchers would think that this is just an administrative procedure they have to fulfill. So it's a rule and a procedure, and not having the inherent conviction that this is important and is part of the science itself. And even, there are some loopholes even within the legislation in that line. So what were the suggestions from the researchers? The researchers thought that it would be important to involve the community and the participant, the community in the consent process, so that we would better understand the community. Training, we have seen there was less of the training level was not as high when we see those who have participated. So capacity building and informing researchers and the research community, and a differentiated approach whereby every locality will be looked in a different way, and not generalizing and not expecting things will go the same in that place as well. And some even suggested maybe doing a pre-assessment before designing the whole consent process, and combining our study with a field visit which has to do with addressing the ethical issues. So maybe doing some follow-ups and see if the consent forms were properly used and the like. And researchers were also a bit concerned about, because of what they thought research ethics committees are doing, like controlling the researchers and making sure that these are in place. And this might a little bit discourage the researchers. So they said the research committee should also try to understand the concern that the researchers have and accommodate that as well. So to conclude, we have seen from this assessment that we have seen there are some critical gaps. Despite the huge expansion in health system research in this couple of weeks, there is no proportional capacity in the ethics review.